Hi, welcome to the Healthcare Partners session for the Survive and Thrive series. Today we have a panel of our healthcare partners where we'll be having a peer-to-peer discussion to provide supportive tips and share about our committee. I'm going to take it away, and I'd love to learn about the committee members on this call.
Hi, everyone. My name is Amy Pappas, and I am an 8-year cancer survivor. I was diagnosed in June of 2017 with multiple myeloma. And in November of 2017, I had a stem cell transplant and am currently getting treated. I have a non-curable but very manageable cancer. So I go every other week to Taussig for chemo. No fun, but look, I'm here and I feel pretty good most of the time. So that is my short story of how I got involved.
Good morning. My name is Kenneth Dabney. I am being treated currently for tongue and throat cancer at Taussig. This is my second bout. I just underwent an operation that was considered successful. I have been a part of the partner team for since 2019, and I am moving forward, feeling okay. It's a day-to-day journey. I understand that. And we'll move forward with it.
I'm Maria Tayak, and I started my cancer journey back in June of 2022. Following a routine mammogram, I was found to have early stage breast cancer, and I did surgery and had radiation, and now I am on a cancer drug for 5 years. And so I'm continuing on this journey.
Hello, everyone. I'm Jeremy Eisen. I had T-cell lymphoma and required a bone marrow transplant in 2023. And that was January, and then I was cleared of everything in May of 2023. So really struggled, I guess, the rest of proportions of that year, but started to come out of it. And then when I heard about this Healthcare Partners, I was really excited about it as I continue to not just survive, but thrive after everything. So I've been a partner since January or February of this year. And yeah, it's been great for me. And I'm excited to have this group tell you what it's about and also hopefully grab some new members.
Thank you for the introduction. I'd like to give the microphone to Amy to learn a little bit more about the healthcare partners and what our mission is.
Everyone can see this?
Yes.
Okay, great. Sorry, I didn't realize my microphone was on mute. So anyway, and one thing I've been, I don't think I mentioned this earlier, I've been part of the Healthcare Partners group for about 2.5 years. And really, it's been such a great, it took me a while to I've missed a bunch of meetings, but now that I'm more active, it's been such a great experience. And we, as I say we, because we all do this, and we hope that you join us in our efforts, but we do value the voice of all of the patients. And if you are interested in collaborating to improve healthcare experiences for yourself, your loved ones, and all patients, we want you involved with our group. So we continually are working to improve the patient experience at Cleveland Clinic Cancer Institute. And we certainly can use your input in achieving this goal because all voices matter. And I think that's one thing patients might not always feel that their voice does matter, but it really does. And I think it's important for all patients to be able to speak and be heard. So that's part of what our group does, and we want your involvement. So we invite you to join us. We are a team of volunteers, and our mission is to improve healthcare through collaboration by serving as an advisor for employees, staff, and administration, sharing our perspective by participating in monthly committee meetings at Taussig, as well as projects, online surveys, and feedback sessions, and participating in respectful and supportive conversations. And just for a consistency purpose, we ask that if you are interested in committing, you do so for at least 1 year, just to really give yourself and the group a time to really hear what we all have to say together and share your input and all of that. So our mission is to seek to represent the diverse populations that are served, transparently, cannot talk today, transparently share our work with one another and engage continuous improvement, improve what exists and dream about what doesn't to drive innovation and results, because we've been able to do that too, which is really exciting to see. In just the short time that I've been involved, there have been a lot of things that have turned around for the better. So that's exciting to see that our voice does have a way to get things done. We work to enhance the lives of patients through compassion and empathy. And some of our accomplishments have included testing infusion chairs, focus groups, and patient education videos. So again, these are all ways that we welcome you to join us. Your voice is important, and we hope that you might come to our next meeting.
Thanks, Amy, for sharing what the committee does. At the end of the conversation today, I will put my contact information, including my phone number, for you to reach out if you're interested in learning more. Now I'd like to move on to the next topic. Can you guys share a little bit more about what you do and past projects?
Well,
So, go ahead, Ken.
oh, I'm sorry. We mentor patients. We speak to them, talk about our journey, and find out how they feel about theirs. I've had the pleasure to talk to several patients. We also have been intricate in the design of the Taussig building in terms of um, chairs, access, and we've been consulted on how the patient feels about their waiting rooms. And we also have spoken to fellows about their communication with the patient, and they've asked for our opinion in terms of the patient view of how they view the fellows or the doctors coming in to see them, breaking news to them in terms of their continual care. Um, I know that I've received feedback from several doctors that from the fact that the fellows have mentioned to them how valuable our input as a panel has been to how they move forward in patient communication. And that's been very intricate and part of our duties on the committee team.
And I'll chime in. One of the most recent experiences that I had with a direct impact of what our group does is scheduling. So I think we all have experienced over the years some scheduling frustrations, just having to even schedule appointments that you don't want to be there to schedule, but then having to either wait for a long time after treatment when you just want to get out of there, or I know for a while we could only get we had to call on the phone. And I remember at one point I was on the phone for almost 2 hours, which I don't have that kind of time. Who does, right? I mean, time is so important to us. So a couple weeks ago, I was at Taussig, and the scheduler came into my treatment room with her computer, and we were able to schedule the next round of appointments for me. And to me, that was a huge win because you're kind of killing two birds with one stone. You're already sitting in your chair getting your treatment, and then you can at least check this off the list, and then it's one less thing you have to worry about dealing with time and spending the time to sit and wait to do that after your treatment. So that was actually a direct impact of what our committee has done, because we all had scheduling frustrations, and so we, again, made our voices heard, and they made some changes. So you too can be part of the solution to the problems.
I think that's great what Amy and Ken said. And um, while scheduling seems like a small thing to an outsider, it's a huge thing to all of us that have gone through it. So I will just share that since I joined in January, February, I think when I heard they had that big of an impact on the new building of Taussig, and what Ken mentioned of, helping out how the room's going to look, how the chairs are going to, just different stuff like that. That's such a big impact. And I think that drew me a little bit in. While we don't have those all the time, I know if they, stuff like that comes up, we will have big say in it. But yeah, from month to month, we're doing stuff like Amy mentioned that now we can show in little ways how we can have a big impact.
And I think I've been in Healthcare Partners about 8 years or so, and I started doing work in other areas of the clinic, and then after after my cancer diagnosis and all, I got more involved with the Taussig group. But I had done some things in successful aging, but one of the things that I felt the happiest about being able to do was a video in which they interviewed patients who had been Taussig patients and wanted to find out their perspective. And this was a video that would be shown to new employees, new caregivers at Taussig. And I think it was really valuable for those caregivers, that patient perspective. And I was glad that I was able to be a part of that and provide that input, to new caregivers coming in to the clinic to work.
Great. Thanks for sharing past projects. I'm excited to share with future members our current projects and our current ideas. I'd like to move on to the next topic. What is the impact of the healthcare partners? What are the results from this team?
Well, I know we received direct emails from the doctors and fellows themselves stating how beneficial the panel had been to their decision making moving forward. We've seen from the design perspective the suggestions that were implemented by the design team from the partner panel at Taussig. We can see it every day as we walk through the lobby or in some of the waiting areas throughout the building. So we see direct results from the discussions that we've had with the various groups and committee teams that ask for our suggestions. And that's been very beneficial to me personally and to our department, our committee.
One of the things that we've had a chance to get involved with is the the once a month high tea that's in the lobby of Taussig on is it the fourth Wednesday, I believe, of the month. And so you're there just as a helper, and directing people and just talking to people. And and it's just amazing. It's patients, it's caregivers, it's employees, and they're all there at Taussig for, something related to treatment and cancer. And you really see that community spirit. And it's just nice to see people being able to help people, put a smile on their face that day, because that, for a lot of people coming in there, it's difficult. It could be a very difficult day. It could be a very difficult time. But for that little moment, they're getting a cup of hot tea and some pastries, and um, there's flowers given out, there's music, and it just is a really nice break for all those visitors on that day. And as a healthcare partner, I find it very rewarding to be able to be part of that and to just smile and say hi to people and welcome them, and maybe make their day just a little bit easier.
So I think one big impact that I've seen is um, people listen. I think Ken and Amy kind of mentioned it, but when they come to our meetings, they listen, and we can, even if it's a small thing like scheduling that we think is big,
Mhm.
that's where they listen to us. So they're taking that with them. I think Megan with music therapy was not, the clinic didn't offer it to survivors. It was just to current patients, and now that's opening up to survivors. So just little stuff like that. I also really enjoy after our meetings, you know, rounding on the floors, maybe during, I don't know the high tea as well, but if they have some form of, celebration down in the main lobby, getting up and talking to people and letting them know the great services at the clinic, Fourth Angel and, therapy and all that good stuff. So I'll let Amy talk a little bit more on that. And then the last thing I'll say is the impact on us, on you as the individual. If you join us, for me personally, it's just a sense of community with this great group. So,
Mhm.
which is so huge for all of us. We know with our mental health and after COVID and all that. So that's where I'm at.
Yeah, and just kind of touching base or circling back with what Jeremy had just said, I think there's, there's so many programs at the clinic that a lot of patients and caregivers aren't aware of. And so to Jeremy's point of being able to make the rounds and talk to other patients and families and, caregivers, it's really, and some of them don't know, but I mean, reflections, you can get massage, reflexology, facial, and Reiki. They have, Megan with music therapy, Lisa with art therapy. And, it's nice to and I think, Bria, correct me if I'm wrong. I think art therapy even has like open hours sometimes where you can just go into the art therapy room, and it's like it removes you in a good way from why you're at that building. And, it's just another um opportunity to meet more people that are going through some sort of experience that you are, whether it's the same or different, but we're all there, we're all in that building for a reason that we don't want to be. So to have like-minded people that are going through something similar, as Jeremy mentioned, it really is a sense of community and support, whether you think you need it or not. And I do, from that perspective, I remember seeing Lisa at art therapy one day, and she kind of tracked me down. I was like, all right, I'll come in. And it was such a nice release of just like taking your brain away from why you're there. It's a good distraction. And, I was killing time between appointments, and it was just a nice way to forget about
Yeah,
cancer.
yeah,
And
yeah,
even
yeah.
even on the treatment floors, a lot of times they have a big, like one of the big poster boards of the coloring with like a bin of markers, just to sit there for 10 minutes while you're waiting for them to call you back for treatment. Again, it's a great distraction. So these are all, things that are at Taussig that we've all made voice of, and they've made some changes. So hopefully you'll want to join us and make a voice for yourself too, because I think sometimes people don't think that their voice is heard. And by having a collective group of people through Partners Healthcare, we've been able to make our voices heard and see results and see things that have changed because of comments and opinions that we've shared with the people that Bria brings on to listen to what we have to say.
Yeah, I know. I've taken advantage of the free yoga, which is twice a week at Taussig, and it's just wonderful. And I found out that I could also watch it from home because the it's a registered nurse who's also
Kim.
the yoga right, Kim.
Kim.
She also has her programs on YouTube, so you can watch it you could do it from home as well. And I think that the whole idea that the clinic is trying to incorporate the patient experience and the patient opinions and ideas, I think it's something that kind of sets them apart maybe from other healthcare organizations. Because I don't know if other hospitals, other hospital systems do this kind of thing, but I think for the clinic, I think that it's a wonderful way to add even more value to what they bring to their care for people going through all sorts of illnesses, but just bringing to the general care that the clinic provides is hearing our voices.
Can I just say one more thing on this too? I think Amy and Maria did a good job of helping people feel how much that can distract you and how great those things are. Now, I'll take it from the perspective of like they're talking growth mindset. That's what it feels like to me, and me and my fixed mindset. And I think back then, especially with COVID, if somebody came around like that, or if I was waiting for an appointment and somebody came around from the healthcare partners, I probably would have been like very short with them and get the hell away from me. But everybody's obviously we know everybody's going through really tough stuff. So we're not saying this is going to change your life. This is amazing. It's great stuff, but we get it. If you don't feel like it that day, just get away from me. That's fine too. It's totally
Right.
okay. We're trying to highlight these services because I think we know how good they are. And then once you're out of it, you're like, oh man, I wish I did more of that. So they're all there for you, but don't take this as you have to do this, you have to do that. It's just really good services, and the clinic
Really is.
does a great job of providing for it. So
Great. Thank you for sharing the impact. The last and final questions with the last few minutes. Do you have any advice you'd like to share to patients?
Go ahead. Go ahead,
okay.
Amy.
All right. So I think the biggest thing that I would share is we all have to be advocates for ourselves all around. And whether that means, asking, I mean, the range is huge of what that means. But I think some people don't feel that they have a voice, or that they can't ask, or they can't do because they're afraid to for whatever reason, or they're going to get in trouble. I don't know. There's a lot of things that might go on with that, but I just think being your own advocate, whether it's for you or someone that you're a caregiver for, is so important. Because if you're not going to say anything, no one else is. And your voice isn't going to be heard, whether you're on the Partners Healthcare or not. This is just a general piece of advice I find, is that we really all need to be advocates for ourselves and for our loved ones.
And I'll say this, just this week, I had an opportunity to talk to a woman who is a patient at one of the regional hospitals. And I belong to a group through my church, and it's all women who have been through breast cancer and other types of cancer. And this woman she's all by herself. She has absolutely no family in this area, in the Cleveland area. And she was trying to navigate going through a diagnosis of breast cancer and being told, well, you need to have this done and this done, and we want you to have radiation, and you need to decide. And she was all by herself. And I think that you need to reach out to someone else to be there with you, to help you at least, understand what the doctors are saying, because when you go into that room, sometimes you don't hear everything the doctor's saying. So if you can possibly have a friend, a neighbor, anybody who can go along with you. I just felt so badly for this woman. And I said to her, and another member of our group, we've also offered to go with her. I mean, we're perfect strangers, but we're not. I mean, we're all, she and I connected because we're in this same cancer journey. And so the other women in our group. So if you're feeling like you have to do this on your own, seek out, a health person, someone at the clinic, a nurse, or just a family friend, a neighbor, whoever, to go with you on your journey, because you'd be amazed at how people will step up and offer that kind of help. And I was really comfortable doing it because of my work as a healthcare partner too. I just felt that I could give her some support as a result of that. So for those people who are watching this, if you are in that kind of situation, please try and find someone, a friend, whatever, to help you on your journey.
I agree with what Amy and Maria said. Also, it's in terms of information, Amy is absolutely correct. You have to be your own advocate. You have to know and inquire about what's about to happen to you. A mentor of mine years ago said, communication doesn't happen until there's tension in the room. And what he meant by that is if everybody's agreeing to everything, nobody's learning anything. And so you have to ask the tough questions. You have to go with how you feel. If you don't know, tell them you don't know. If you don't understand, say, I don't understand. Because what happens is, and I don't want to seem callous or ungrateful, but doctors see a lot of people and they're human. And sometimes things get mechanical. They don't mean it to be that way, but it just gets that way. So if you don't step up and step in and understand the moment that you're in, then sometimes that moment can pass you by. And you don't want that to happen. You don't want to be in a hospital room saying, what the heck just happened? I know one thing in particular, and then I'll close it. Plan care visit is another tool that the committee at Taussig gave to the hospital. And it became an absolute important tool because what feedback we got when we visited patients' rooms was one doctor said one thing, another doctor said another thing. We don't know what's happening. So what planned care visit is, it's your ability that the Cleveland Clinic has given you to have all your doctors in the same room. So you can ask them particular questions and get unanimous feedback. I know from experience just this last time, it was absolutely important because I had 3 very good doctors. They've been with me for 7 years, and they were saying 3 different things. And so once I got them in the same room, there was consensus on how to move forward. So, in other words, this committee has come up with some valuable things that have impacted patient care. And that's something that we all can be proud of. And that if you join the committee, you can be proud of. Because that's what it's about. It's about having positive impact on patient care.
I just want to build on Maria's because that is probably the biggest thing for me is mental health. And I just talk to quit being stubborn and just talk to a therapist, talk to a psychiatrist, whatever you got to do. Um, you can talk to family and friends; they're amazing, and you need that too. But then get somebody else because I was stubborn about it. I didn't talk it out, and then I get quiet, and then like we all do, we go down rabbit holes and we think about all these things that are illogical and they're just you just cling to these things and I just know how it damaged me a lot and I'll just say so Dr. Choko was amazing for me and she said something to me one time. She said, you know, Jeremy, there's a logical reason for all this. Like you have disease, you have chemo, you have drugs, it's inflammation, all this stuff, it's not all in your brain. Like so if I would have been continued to be stubborn and not heard that, that totally changed things for me. And I started to feel a little bit better on that. Um, so as much as you can talk, um, and then I will say, I've learned also if you can maybe get out of your own, you start to talk and get out of your own brain, out of your own head, go help somebody else and it helps you, you know, write a note, write a letter to somebody that was with you or whatever it is. Oh, I'm having a bad day. You know what? Help somebody else and it just instantly starts to make you feel a little bit better. Last thing
Yeah.
I'll say is try to do the little things. I don't know where people are at in their journey right now, but if they're going through the worst of it, that was the biggest thing I heard was do the little things. Brush your teeth, take a tiny little walk, read one page of a book, just take care of the little things and then you don't know when you're going to come out of it, but when you start to, it's going to happen a lot better when you have taken care of those. You're just not spiraling downward. So thanks for listening. That's all I got.
Thanks to the healthcare partners today for sharing their stories, the impact, and why you should join. If you are interested, my name is Bria and my direct line is 216-445-2273. And to watch this video again, it will be posted online. Thank you and have a great day.